Hi, my name is Hannah Harwood and I'm here to present my final year dissertation project to you, Personality and Intimacy within 21st Century Mental Health. So before I begin, I just thought I'd give you some background information. So I'm currently in my second year of Masters doing the MSc Counselling course at Bangor University. I've had a strong passion and interest within mental health for many years, and this has emerged through my own struggles, but also my understanding and love of psychology, which I also study here. And I have a keen interest to work with young people to support the ever-growing need of mental health services for this population, and I'm lucky enough to say I've actually secured a position. So why this project? What was my passion for wanting to understand this further? Well, from my current client work thus far, most of my clients have discussed relationships within their life in some capacity, whether this is positive or negative, highlighting the prevalence that connection with others has in 21st century society, particularly since we've moved into a remote world. Furthermore, considering Rogers and his statement, the relationship is both necessary and sufficient for therapeutic change, this corroborates that between mental health practitioners and clients we work with, that this foundation really is crucial to foster a strong working relationship, one which is sensitive to the client's needs. And finally, considering disposition, personality in particular, we know the effects this plays into everyone's lives, but homing in on those in a caring profession, this can create demands on both client and practitioner, and thus understanding the relationship means the correct support can be put in for both client and practitioner to prevent boundary breaches or burnout. So what do we know about personality so far? Well, personality can be defined as a collection of characteristics and behaviours of an individual's concepts surrounding their life, drives, interests, abilities and emotional patterns. It is a well-investigated area within research with consistent evidence highlighting the strong relationships between personality and all aspects of one's life, including well-being, satisfaction and relationships. Despite this not being the primary focus, it reinforces the effect of personality and thus how each individual dimension has a significant role to play in outcomes. To break personality down further, as mentioned about dimensions, we can compare this within the 5-factor model, or the Big Five, by Costa and McRae. They split personality into 5 dimensions, including openness, conscientiousness, extroversion, agreeableness, and neuroticism. By breaking down into the 5 dimensions, it allows us as researchers to score different areas and assess how one's disposition may be being presented. So neuroticism. This is a dimension, as noted, and it is the dimension typically associated with emotional stability. Research thus far exploring this dimension has highlighted those with higher scores tend to suffer from more psychological issues. These issues can include mood disorders such as anxiety and depression, but also translates into personality disorders such as schizophrenia or borderline personality disorder. Researchers also pointed to the negative impact high neuroticism levels can have on physical health, including increased risk of cardiac problems, diabetes and IBS. If we consider this within a post-pandemic world, it's likely to suggest that those who've suffered with high level of neuroticism have experienced more intense emotional responses with regard to the pandemic. And research does in fact highlight a positive correlation with this between high neurotic individuals and COVID-19 related information, particularly crisis preoccupation, and their attention and worry to such information. Thus, considering 21st century mental health, as we move out of such times, this makes this predictor a crucial element to study. It's important to consider that there is current research linking neuroticism and particular helping professions. This is mainly within medical professions, however. The research suggests that helping professions or helping professionals who are exposed to another individual's trauma can lead to a stress response, and stress is a component associated with an increased risk to neuroticism. Furthermore, certain dispositional traits such as high levels of extroversion have found to serve as a protective factor, whereas high neuroticism levels can deter this. Intimacy can be defined as the ability to form a close relationship with another individual and being able to express emotional, intellectual, or romantic thoughts with them. There are various types, including emotional, informational, and physical. And due to the COVID-19 pandemic, this has created an inability to have intimate connections due to forcing individuals to socially isolate, which in turn can reduce intimacy between loved ones and increase psychological issues. Thus, it is understandable to think about the negative repercussions that may be higher. Age can be defined as how old one is at a point in time. Age is a useful demographic variable because it helps identify trends amongst populations and predictors within the mental health field. Additionally, research does suggest the older you get, the higher help-seeking behaviour becomes. Although we are not looking at help-seeking behaviour in this study, if we think similar elements of intimacy, then it is understandable to look more closely at this relationship considering a client or a mental health practitioner and how this may correlate. So the aims and hypothesis based on the research then. The aim was to investigate the relationship between neuroticism, intimacy and age. We've hypothesised that there will be a relationship between all covariables, so neuroticism and intimacy, neuroticism and age, and intimacy and age. So the method of the study. The study was open to anyone over the age of 18 and there was no other exclusion criteria. Participants were sampled using opportunity sampling through SONA, or the Student Participation Panel, which is an in-house university research system for students. Additionally, through social media such as Facebook and also word of mouth. The study was a correlational design with all the covariables being tested, including neuroticism, specifically escape, intimacy, and age. Participants were then required to complete a series of questionnaires. Firstly, they received an information sheet which described everything that they would do during the study. They then had to give their informed consent before they could continue on these online questionnaires. And then the questionnaires consisted of demographics, the Big Five personality questionnaire, and also the attitudes towards intimacy scale. The measures you can see are listed at the bottom, including Intimacy Attitude Scale, the revised version by Amidon et al., and the Big Five inventory, and a demographics which was created by us as researchers. So what were the results of our study? Well, 249 participants between the ages of 18 and 72 years completed the study. However, after excluding ineligible data, 169 were used for data analysis. The data was a mixture of normally and non-normally distributed, thus Spearman's Rowe stat test and Pearson's R were used for statistical analysis. Pearson's R specifically between intimacy and age, and then Spearman's Rowe between neuroticism and intimacy and neuroticism and age. So the next three slides highlight the significant relationships found from the study. It must be noted that due to reverse coding for data analysis, neuroticism, the higher the score, the more neurotic a participant was. However, the higher a score in escape intimacy means they present a lower level of this item. So the neuroticism and escape intimacy relationship, there is a negative correlation as shown from the graph. This means that those who scored higher in neuroticism had higher levels of escape intimacy. So this graph shows the relationship between neuroticism and age. As we can see, this is another negative correlation whereby the older that you are, the less neurotic you seemed to be. This is particularly notable from the oldest participant, who was 72, as noted within their neuroticism score between 10 and 15. If you look along the neuroticism rating and go up 72 is the highest one. The final graph is the relationship between escape intimacy and age, and as we can see, as your escape intimacy increases, the age seems to increase as well, as shown from a positive correlation. This translates to that the older that you are, the lower your escape intimacy score, as noted before. So looking at the findings of the study further, the original aim was to look at the relationship between neuroticism, intimacy and age and consider this in the 21st century mental health field. The hypothesis was that the covariables would all have relationships, and indeed the findings corroborate this, with correlations being significant amongst all covariables. However, correlations were weak. One reason for this was definitely due to the sample size and the population size, which will be discussed further. But looking at relationships more closely, neuroticism and escape intimacy, we identified that if individuals were higher on neuroticism, their escape intimacy was also higher, which could suggest individuals are more vulnerable to stress based on the research that exists already. Considering the research, the relationship would seem to be in accordance with existing literature. A dated study by Cunningham and Strasberg investigated neuroticism and disclosure reciprocity. As we know, being able to disclose and being intimate with another is part of intimacy, thus we can draw on the similarity. They found that those who were more neurotic had difficulties disclosing information to researchers and understanding the reciprocation of when researchers over-disclose to them. Thus, this is important to bear in mind given the current research, particularly considering mental health practitioners who may score highly on both, because when working with clients it is crucial to be emotionally vulnerable with your client in order to be able to accept this, whilst also managing one's own difficulties, for example, any mood disorders a practitioner may have. So the relationship between neuroticism and age highlighted that the older the participant was, the less neurotic they noted themselves to be. Similarly to Mackenzie et al.'s help-seeking behaviour study, they also noted that older participants were more likely to ask for mental health support and seek this support. Although they were looking at help-seeking behaviour, considering our own study, if we consider a similar concept where an older participant could ask for mental health support, they are actually putting themselves in an emotionally vulnerable position, an element which is crucial in creating intimate connections. Thus, this will reduce neurotic tendencies and the associated psychological or wellbeing issues that come as a result of having high neuroticism. With this in mind, considering what predictors amongst younger populations may be beneficial for why they result in higher levels of neuroticism, potentially socio-economic factors, COVID-19 issues, or the fact that they are more exposed to a social media world. Thus, maybe exploring this further would be interesting. So the next relationship highlighted that the older the age of the participant, the less escape intimacy that was exhibited. Considering the wider context of this, perhaps this has come from a need to be closer to loved ones as you grow older to reduce the fear of isolation and loneliness. This is particularly present in today as we come out of the COVID-19 pandemic. Furthermore, considering helping professions and professionals that are older, they may have more of an empathic understanding of this concept of isolation and loneliness, thus increasing vulnerability to discuss intimate topics, highlighting why older individuals may have less escape intimacy issues. So considering the limitations of our study, a massive problem was surrounding sample size and the method of sampling. So firstly, method of sampling was opportunity sampling, thus the study was open to anyone available by chance. A large proportion of this was within the university from students who completed SONA, and thus the array of older participants was few and far between. For this reason, future applications may want to use systematic sampling to divide participants evenly across age ranges and conditions. Furthermore, sample size, we could need to increase the number of participants that completed the study. A massive component of this was ineligible data, which had to be excluded. An increased sample size would allow closer analysis of what the age differences highlight between the neuroticism and escape intimacy relationship, and could increase the reliability of our data and the current significant findings that we saw. So considering future directions based off our study, we know there was a relationship between the covariables, with age highlighting a strong role to play. Given that neuroticism and escape intimacy seem to be higher amongst younger populations, looking at how age mediates this relationship and the span across younger to older populations would be beneficial to identify if certain populations may need more support when working with the mental health professions. Furthermore, looking at different occupation types amongst helping professions may be also beneficial to assess if this influences the mental health support given to patients or clients for that matter, or the support they access for themselves, and further highlighting if certain professions do suffer, may need extra support put in place. These are my references that I've used throughout my presentation. So that brings us to the end of the presentation. I want to thank you for listening, and please ask any questions in the comment section below and I will be happy to respond to them. Thank you very much.